Good afternoon. So we have
a guest blog. Current issue: is Lipodissolve a good way to melt away fat? So you're familiar with the chemistry of lipids and the structure and function of fat cells. You understand that when your average daily caloric intake exceeds your average daily caloric expenditure, you gain weight. And blah blah, some people are still fat. Blah blah, they try dieting and exercise and they're not happy. And there is a way to melt away unwanted fat, kill fat cells, like completely eliminate them, and sculpt your body into the shape that you want without having to diet or exercise. And it's called Lipodissolve. It is a controversial cosmetic procedure. Lipodissolve, also called injection lipolysis, is described by its promoters as a safe, effective, non-surgical way to sculpt the body into perfect shape. Usually the technique is performed as a series of 6 treatments 2 weeks apart, each treatment consisting of injections directly into subcutaneous fat deposits. You with me so far?
Yeah, I'm with you.
Okay. The injections contain 2 active ingredients. A phospholipid, and a bile acid. I'm not going to read their names out because they're really long.
Complicated and annoying.
Yes. The combination of these 2 drugs, known as PCDC, allegedly works by dissolving the bonds between the 3 fatty acids and the glycerol backbone that comprise a triglyceride molecule, the primary molecule form of stored fat in the body. So PCDC also is thought to disrupt the cell membranes of fat cells in the vicinity of an injection, resulting in the death of the fat cells themselves. Yeah, so that is what it is. It says, at the moment, the safety and efficacy of Lipodissolve are not backed by scientific data, or at least were not as of 2010. I don't know if things have changed since then. Not approved by the FDA as a fat-reducing therapy. But even without FDA approval, health clinics and spas can legally administer Lipodissolve because of a loophole in the drug regulatory laws. A licensed doctor can legally and ethically formulate and prescribe compounded drugs, specifically for individual patients, as long as all of the ingredients are approved by the FDA, and as long as the compound is made by a licensed compounding pharmacy. The intent is to protect the sanctity of the doctor-patient relationship, allowing the doctor to choose what is best for that particular patient. Both of the compounds used in the Lipodissolve technique have been approved by the FDA as ingredients in other drugs, though neither was approved as a fat-dissolving drug. Health clinics and spas have been quick to capitalize on the loophole, for at nearly $2,000 per treatment, they stand to make a lot of money. Most patients who try the technique eventually sign up for treatment of several body parts. Women generally request, well, okay, you don't really need to know what women request. They don't say what, and they do say what men request as well, but that's not really relevant. Anyway, one of the first companies to offer the Lipodissolve technique in this country was Advanced Lipodissolve Center, later renamed FIG, short for figure. FIG's Dissolve to Your Beautiful Shape advertising campaign was so successful that the company grew to 18 body-shaping centers in 8 states in 2 years. The company went out of business in late 2007, but there are still plenty of other clinics and spas willing to perform the Lipodissolve procedure. Lipodissolve is not a great way to lose weight overall, but if it works as advertised, it could be a way to reduce fat in specific places, which is, spot fat loss. Yeah, one of the distinct advantages of the technique is that because it does not involve surgery, there's no recovery period. Is Lipodissolve safe and effective? Critics of the Lipodissolve technique argue that the current law covering single doctor-patient relationships was never intended to allow mass marketing by chains of clinics or spas or mass compounding of the PCDC drug combination. The American Society of Plastic Surgeons, the American Society of Aesthetic Plastic Surgery, and the American Society of Dermatologic Surgery have issued cautionary warnings against the technique, but that's understandable since all three societies represent surgeons who might be financially affected by Lipodissolve's increasing popularity. The FDA is investigating and evaluating the situation, but as of 2010 had not interfered with the activities of the clinics. So far, there are only anecdotal reports of unwanted side effects immediately after Lipodissolve treatment, such as swelling, skin blistering, pain, and blackened skin in some patients. No deaths have been reported. However, because the technique has been performed in this country only since 2004, the long-term consequences of Lipodissolve therapy are still unknown. Now, this was published in 2010. It is now 10 years after 2004, 11 years after. So I would think that, I would think that there would be some knowledge of long-term consequences, but of course this textbook is not self-updating. Some scientists worry that the disruption of fat cell membranes at the site of injection might cause a sharp rise in cholesterol in the blood. One sec. After all, cholesterol is a normal constituent of cell membranes. In addition, little is known about how the Lipodissolve drugs are metabolized or removed from the body, nor is it known whether they enter the circulatory system in sufficient quantities to affect other organs or tissues far from the injection site. As for whether or not it works, some patients see an improvement in body shape, others do not. There's no standard dose of Lipodissolve. The procedure, obviously, it's not regulated by the FDA, so physicians are free to try any combination of doses and injection intervals as they want. Let's see, in 2007, the FDA approved the first clinical trial of Lipodissolve, a double-blind, placebo-controlled prospective study that would follow patients for up to 46 weeks. The trial... Well, I don't know how the results are, but as of 2010, they said the trial would be conducted by the research arm of the American Society for Aesthetics Plastic Surgery. Is expected to provide the first scientifically defensible data on the efficacy and safety of Lipodissolve. Now, what do you think? This is mostly, this is an opinion blog, so I wanted to know, Loki, what you think of Lipodissolve.
I think it's really just another lazy shortcut that people created.
Mm-hmm.
I mean, I don't really care about the side effects or whatever, but, I mean, it's basically just another fast, easy way out for Americans. Everybody, lol, this is gonna be so easy, it's so fast, you just have to pay this one payment of half your soul, and you can be fat-free and slim and amazing, and blah, blah, blah. It's basically just more of the same usual, consumerist crap that we deal with on a daily basis these days. So, really, I mean, as far as the whole thing about it with the anecdotal, terror tales or whatever of black skin and whatever, I don't really think that's real. It's probably just, shit that people are making up because, they want to stay in business. That doesn't mean I support it. Frankly, I'm indifferent to it because it's not really something that's a problem for me. And even if it was a problem for me, I really wouldn't care.
You're really lean. You're a very lean man, and I love you.
My point is that it's not really something that's, big on my mind. But if it was, I mean, if I were a plastic surgeon or whatever, and if this was affecting my business, I'd probably either A, go for it instead, or try to evolve my business to the point where it makes use of it. Like, I guess you could say, like, it becomes a part of my business, something like I can do,
Okay. Well, I have thoughts on it too, so.
Okay, so my thoughts on it are basically that it sounds really dangerous. I mean, when you lose weight, you don't lose fat cells, but your fat cells do shrink. Now, eliminating the number of fat cells that are in your body are the number of fat cells that are supposed to be in your body. Okay, they expand and they shrink, but they're there, and they're kind of, there for a reason. They're there to store adipose, they're there to store energy. I think eliminating fat cells could be really dangerous. I think it's bad to mess with the natural chemistry of your body. Now, I am chubby, I'm Loki's lean, I'm not. I've considered alternatives besides exercise, because I'm terrible at exercise. I mean, my body will rage quit after like 5 minutes. I don't have stamina or anything like that, which probably just means I need to exercise more and not be a lazy ass. But no, I think that surgical alternatives to exercise are not that great. And I know this is not surgical, it's an injection, but honestly, I don't want something that might blister my skin. I don't really care if it's an old wives' tale. I don't care if it's made up. There's, it's either way, it's unnatural, and I think spot reduction. As far as weight loss goes, spot reduction is not really effective. And as I said, it's a crapshoot. Some people, they improved their body shape, some people did not. I'm not gonna take a risk on something that isn't a sure thing. Let's see. Did you have any more thoughts? No. Okay. Well, that has been our opinion piece for Lipodissolve for today. So, yeah, that is what we think. Let us know what you think in the comments, etc. Subscribe, like, blah blah, all that crap. I really, yeah, just trying to get this potentially outdated information out there before I have to give up my lovely, lovely textbooks.